page 838. All right, we're talking about documenting sexual assault on the right-hand side of the page, very top of the page. What do you need to do with your report? Well, you need to keep it concise and record only what the patient stated in her own words. And then read down a little bit longer. Remember that rape is a legal diagnosis and not a medical diagnosis. So keep it concise, record only what they say in their own words, and that it's a legal diagnosis, not a medical. And that's pretty much it for that. Okay. Chapter 24. There's a lot in 24. Where's 24? Trauma. Okay. Trauma's easy to, you guys know that. Let's start out with 855. Don't stop. Right-hand side of the page with rear end crashes. Halfway down the paragraph, talking about the cervical spine. It's less tolerant of damage when it is bent back. Headrests decrease extension of the head and neck during the crash and therefore help reduce injury. So the headrest needs to be, in the normal position where the head, in fact, the head is. If it's not, the headrest isn't in the right position, you can still get really injured bad with the neck. Right. All right. Go to page 860. Cavitation. There's a highlighted word called cavitation on the left-hand side. So the bullet speed is another factor in the resulting injury pattern. There it is often additional damage caused by the object moving inside the body, but not along the suspected pathway. This phenomenon is called cavitation, which results from the rapid changes in tissue and fluid pressure that occur when the passage of projectile can result in serious injury. So know what cavitation is? It's basically the pressure wave in a nutshell. It's the pressure wave that happens once the bullet enters the body. So no cavitation. Okay. 863. Pulmonary blast injuries. Primary blast Primary blast injury is often characterized by a lack of external visible injuries and thus can go unrecognized. The patient may report tightness or pain in the chest and may cough up blood, which is called what? Cricket?
Hemoptysis.
Hemoptysis. Make sure you know that word because they're going to report tightness in their chest, pain in the chest. They may cough up blood and have tachypnea, which is what?
Fast breathing.
Fast breathing or other signs of respiratory distress. You may get subcutaneous emphysema. It could be detected over the chest through the use of palpation. So those are all your common pulmonary blast injury symptoms. You know those. 46. Page 853. Go back a little bit. Know what deceleration is, right-hand side of the page. Know what an airbag is designed to do. It's like the second or third sentence. Airbags provide the final capture point of the passengers and decrease the severity of deceleration injuries. So airbags are pretty much, they decrease the severity of deceleration injuries. Know about airbags. 55. 862. Oh, 862. Know those four things: primary blast, secondary blast, tertiary blast, and quaternary blast. Know what happens in each one of those blasts. So if they describe it, you'll know what part of the blast they're talking about. Page 852. We'll go back a little bit. Oh, they're talking about someone being killed, one person dead in the car and the other one's not. So right hand side of the page, under the bullets, damage to the vehicle, blah, 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 scene size up. Clearly, if one or more of the passengers are dead, you should suspect that the other passengers have sustained serious injuries, even if the injuries are not obvious. So death of a passenger in your vehicle, that's actually a trauma alert criteria for us, even if the patient doesn't look injured. But if there was enough trauma to kill someone, they probably got a lot of trauma too. So, all right, page 861. 861. Recognizing developing problems in trauma patients, table 24-1. Index of suspicion. And when we're talking about the chest wall, so the second set of bullets under index of suspicion for chest wall blunt trauma, you've got some of the stuff that you should suspect if they've had significant chest wall is cardiac or pulmonary contusion, any type of a pneumothorax, and broken ribs. So anything chest area, if you see damage to the steering wheel, the dash, whatever, those are some of the things that you should suspect from chest injuries. All right. That was 72. Page 849. 849. Potential energy right inside the page. So they're talking about if somebody falls. They're talking about this worker that falls under potential injury. If the worker falls, the potential energy is going to be converted into kinetic energy. So as the worker hits the ground, the kinetic energy is converted into work. That is the work of bringing the body to a stop and thereby fracturing the bone. So basically we're talking about as the person is falling, the potential turns into kinetic. And that's what brings the body to a stop, the kinetic part. So it goes from potential to kinetic to stopping. 856. Rollover crashes, left-hand side, towards the bottom of that paragraph. The most common life-threatening event in a rollover is ejection or partial ejection of the passenger from the vehicle. So that's the worst thing that can happen to the rollover. Ejected or partially ejected. All right. All right, chapter 25. All right, chapter 25, page 885. Hematomesis. All right, right hand side of the page, it's folded. It's highlighted. Hematemesis. The vomiting of blood. The vomitus may be bright red or dark red. If the blood has been partially digested, it's going to look like what? Coffee grounds. So be careful with gastrointestinal bleeding. So when we're talking about gastrointestinal bleeding, would we have hemoptysis if we had gastrointestinal bleeding?
We could.
Yes.
We would.
Well, no, not bright.
Anybody else?
I'm gonna go with no then.
We could, can't we?
Why would we have hemoptysis?
Throwing up blood. Because there's
I'm sorry. Yeah, hemoptysis. Hemoptysis.
cough. Oh no, not I'm sorry. I thought we were still talking about vomiting up blood.
Yeah, that's hematemesis. So be careful with the words. You see where I'm going with that?
No.
Just because you see hema, you go, ooh, hema, and then you start, but you didn't read hematemesis or hemoptysis. Because if it's hemoptysis, they're coughing it up. Is that GI?
No.
Okay, that's my point. So be careful there.
Okay.
Okay. We're in chapter 25, bleeding, page 888. Okay. Oh God, really? Right hand side of the page, external bleeding, emergency medical care. There's 3 bullets. Make sure you know those. So several methods. Obviously, direct is the first one, then a pressure dressing, and then obviously tourniquet. So those 3. Page 885. Signs of internal bleeding. Down at the bottom of the page, on the right-hand side, that last paragraph. Second sentence, we're talking about non-trauma patients. So the first sign of hypovolemic shock is a change in mental status such as anxiety, restlessness, or combativeness. But in non-traumatic patients, weakness, fainting, dizziness on standing is another early sign. So if they're non-trauma and they have weakness, fainting, or dizziness upon standing, that could be an early sign of internal bleeding. Let's remember that. And 883. 883. This is a control for vein. Right hand side of the page, venous bleeding. Under the bullets, it's the second paragraph. Venous bleeding from an open vein is dark. It can flow slow or rapidly depending on the size of the vein. But here's the main thing. Because it's under less pressure, most venous blood does not squirt and is easier to manage. And obviously know about, your blood, here are they. Change of blood to wall. Questions. Comes in several factors. Blood, 88. I can't find the page. Talking about blood clotting.
Page?
880 on the left-hand side at the bottom of the page, towards the bottom. It's like midway through that paragraph. Blood clots are an important response from the body to control blood loss. In the body, blood clot formation depends on what? Several factors. So blood clot formation depends on blood stasis, vessel walls, changes in the vessel wall, and obviously our body's ability to clot. Those are three things. So blood clots depend on those three things: stasis, changes in the vessel wall, and the ability to clot. Chapter 26. Big spot. Here we go. 26. Go to page 906. Okay. Okay, there's the dermis. Okay, I'm sorry. There's the epidermis and the dermis. Know that the epidermis is obviously the outer layer. It's the watertight covering. And then the dermis is the one that has the hair follicle, sweat glands, and sebaceous glands. So know your layers, the layers of the skin and what's located in the layers of the skin. Actually, there's a good picture right there at figure 26-1. If you study that, you should be good there. Okay, go to page 909. Know what an avulsion, a laceration, and an incision and a penetrating wound are. If they describe one of those or two of those, three of those, you should know which one is which just by reading the definition. So abrasion, laceration, avulsion, and penetration. If they describe, you should know. 28. Here. Page 920 to 921. 921. Oh no, just basically 920. We're talking about impaled objects. Number one, don't attempt to remove it unless it's impaled through the cheek. And basically, again, if it's something that's long, like a pole or a branch or something like that, you're going to obviously have to cut it to make it, to be able to get the patient into the truck. So, and then obviously stabilize it with a bulky dressing, and you should be good there. So don't ever pull stuff out. If it's too big or too long, you'll just have to cut it so you can get them in the truck. And then once you do, you're bulky dressing it and you're good to go. So know how to stabilize a penetrating object. Page 906. Towards the front again. Okay, right hand side of the page under physiology, second paragraph.
Which page? 926?
906.
Copy.
Right hand side under physiology. Second paragraph. The skin is the body's major organ for regulating temperature in a cold environment. The blood vessels in the skin constrict. They divert blood away from the skin and decrease the amount of heat that radiates from the body's surface. Remember, then we shunt it to the organs that actually need it. So that's what happens when it's cold. So know what happens when it's cold. When it gets cold, what the skin does. 33. Page 923. I think you guys already had this. When they're talking about the bites, the human bites. So obviously the person that actually hits somebody and they break their skin on, let's say in their mouth or whatever, that person is also needs treatment because they get bacteria in their cut. So it's not only the person who gets punched, but the puncher.
is also susceptible to infection.
74. Here. All right. 907. 907. Right-hand side of the page, second paragraph. The next stage of wound healing. During the next stage of wound healing, new blood vessels form as the body attempts to bring oxygen and nutrients into tissue. New capillaries bud from the intact capillaries that lie adjacent to the damaged skin. So if you read down just another sentence or so, because they are new and delicate, bleeding might result from a very minor injury. So it can open up again because they're very delicate, and bleeding might result from a minor injury. So that's in the second wound phase. Wound healing. Yeah, there's a lot missing. Page 925. Full thickness burns. What happens in full thickness burns? Well, the burned area is dry and leathery and may appear white and dark brown. Read down a little bit more. If the nerve endings have been destroyed, a severely burned area may not have feeling, and the surrounding less severely burned areas are going to be extremely painful. So remember, you can always have second and first along with the third of full thickness. Okay, and then last two. Page 926, that's the palmar. The palmar, which is, where's that? Yes, where is that? 926, it says. Oh, it's right there at the beginning of extent. You guys already know that, the palmar. So one quick way to estimate the surface area that has been burned is to compare it to the size of the patient's palm, which is roughly equal to what? 1%. Remember, it's the patient's palm. So if it's a little kid, it's their little palm. That's 1%.
That was on what page?
That's on 926.
926.
Yeah, underneath.
Oh, I see it. I see it. Sorry.
Yeah, it says extent. The very first sentence or second sentence.
Got it.
So it's always the patient's palm. Page 906. 906. Where they like this page. Okay, right hand side of the page, we're talking about the third paragraph. The skin covers all external surfaces of the body. The various openings in the body, including the mouth, nose, anus, and vagina, are not covered by the skin. They're covered by mucous membrane. So know which parts are not covered by the skin. What should you do? All right, 27. Page 959. Eye injuries. Right hand side of the page, underneath the 1, 2, 3, 4, read down about 3 or 4 sentences in that paragraph. When you see or suspect an impaled object in the eye, bandage both eyes with soft bulky dressing to prevent further injury to the affected eye. Remember, we talked about that. Why? Because when you look at something and your eye turns, it goes with both eyes move at the same time. So you want to bandage both eyes. Here. 950. Page 950. You've got, optic nerve endings, Okay. All right, the retina. We're talking about the retina, left-hand side. Like the lens of the camera, lens focuses on images like from the back of the globe called the retina. Now, within the retina are numerous nerve endings which respond to light by transmitting nerve impulses through the what? The optic nerve. So, know that the retina responds to light by transmitting nerve impulses through the optic nerve, in a nutshell. 16, 20. The page before it. So, a couple things you need to know about the eye. You need to know that it's called a globe. You also need to know that the inner surface of the eyelid are covered by a delicate membrane called the conjunctiva. And then read down a little bit more, and the white of the eye is called the sclera. So know those three things. The globe, the conjunctiva, and the sclera. Know what each one is. Page 952. 952. Wait, that's not right. What are we on? Okay, yeah. 952. Oh, primary assessment. Okay. Facial trauma. Okay. Under primary assessment, life-threatening injuries. When there's obvious active life-threatening external hemorrhage, it should be addressed before airway and breathing. We already know that we can't like start treating all those wounds unless the airway and breathing is done first. So that's kind of a given question there. Primary assessment, you guys know that. All right. That was 21, 32, 33, 34. Page 947. Go back a little bit. Know all the parts of the face. Your mandible. Where's the file? Here it is. Mastoid. Right hand side of the page, about 1 inch posterior to the external opening of the ear, is a prominent bony mass at the base of the skull called the mastoid process. And then obviously know what the lower jawbone is called the mandible. Well, you guys already know that. That's anatomy stuff. Okay, 33, 37. What is that? You guys know it. 2 grades on that. You already know that. 7, 30. Last but not least, 947. Same one, same page. The tragus. Looks like it's above the mastoid process right there. The tragus is a small, rounded, fleshy bulge immediately anterior to the ear canal. So know what a tragus is. The superficial temporal artery can be calculated with the tragus. So the tragus is a small, rounded, fleshy bulge immediately anterior to the ear canal, and then you need to know what the mastoid process is. So don't get those two mixed up. Make sure you know the definition of each of those. I think that was it, right? 39? Okay. Chapter 28. All right. 1013. 1013. 1013. All right. I think we can continue with that. All right. Sitting patient. Okay. Some patients with a possible spine injury will be in a sitting position. With these patients, you should use a short backboard or other short spinal extrication device, better known as the what? The KED. Those are the sitting patients that are possible spinal injuries. Obviously, if we don't have to do an emergency move on them, we're going to take the time to put a short spine board on. So, or a KED, which is what you guys know of that. Okay. So that's the sitting patient. Page 996, go back a little bit there. 996 is right hand side of the page. Second paragraph, the physical examination may be systemic full body scan or a systemic assessment that focuses on a certain area or region of the body. So what are we talking about? Well, we're talking about either a full head to toe, or we're talking about a focus. So if it's just an ankle, I twisted my ankle walking down the stairs, I don't need to do a head to toe. I'm just going to do a focus on the foot. So, you know, it's kind of scenario based that way. Just know which one you're going to do a focused on and which one you would do a complete head to toe on. You should be fine. So that was 12, which was 15. Page 1007. 1007 to 1009 is what it's there. I can see what the top of that. Yeah. So just page 1007. On supine patients, you've got numbers 1 through 12. Just know when you very first start out, as soon as you come up to the patient, you maintain inline stabilization, and then the very second thing you do before you even do anything else is you do PMS. And then obviously put the collar on them. But as soon as you get somebody hold C-spine and then quickly do a PMS on them. And then you're going to start putting the collar on in that order. 1, 2, 2. Here. Go to page 987. 987. Done. Okay, 987. Skull fractures. Signs and symptoms of a skull fracture. Left-hand side of the page of 987, right under the picture. The diagnosis of skull fracture, blah, 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 blah. But maintain a high index of suspicion that a fracture is present if the patient's number one, head appears to be deformed. Number 2, if they have raccoon eyes, or number 3, if they have battle signs. So signs and symptoms of a skull fracture: deformed skull, raccoon's eyes, battle signs. Page 983. Reflex arc. Know what a reflex arc is? That is right hand side of the page under how the nervous system works. Second paragraph, second sentence. If a sensory nerve, obviously in connecting the sensory motor nerves of the limbs, the connecting nerves in the spinal cord form a reflex arc. If a sensory nerve in this arc detects an irritating stimulus such as heat, it will bypass the brain and send a message directly to the motor nerve, causing a response. To know what a reflex arc is. Page 990. Page 990. Concussion. Know what a concussion does. Read down a little bit, like the third sentence or so. Third sentence. There's no universal agreement on the exact definition of a concussion, but in general, it's a closed injury with a temporary loss or alteration of a part or of all of the brain's abilities to function without demonstrable physical damage. So you don't have any physical damage, but you do get that temporary loss of function. So know what a concussion is, and know what's the other part? Concussion may result in unconstitutional ability to breathe interpret. 90% of the patients who sustain a concussion do not experience a loss of consciousness. So 90% don't experience a loss of consciousness with a concussion. And that it's a temporary, loss. So know those things about concussion. 46, 48. Page 995. All right, ETCO2 levels. Left-hand side of the page, down towards the bottom, right above the last paragraph. Know the range that it needs to stay in, the ETCO2. Needs to be between 30 and 35 millimeters of mercury. So even when used, hyperventilation should be used with caution and only when capnography is available to ensure an end-tidal carbon dioxide level between 30 and 35 millimeters of mercury. So know that level. Page 999. 999. The picture, figure 28-19. With severe spinal injuries, patients may lose sensation or experience paralysis below the suspected level of injury. So wherever the injury is, everything below it, bye-bye now. Please. 989. Back a little bit. 89. Know what an epidural hematoma definition is. It's an accumulation of blood between the skull and the dura mater. It's nearly always a result of a blow to the head that produces a linear fracture of the thin temporal bone. So, very linear fracture of the thin temporal bone, and blood accumulates between the skull and the dura mater. I remember that. By review. All right, you guys want to cut it off there?
Yeah, we could do that.
Okay.
I'm okay with cutting it.
Ready, that as well.
Okay, cool. Because I gotta work tomorrow, so I still gotta get ready and stuff like that. But if you guys want, we can try to knock some of this out tomorrow while I'm on shift.
Absolutely.
Yes, ma'am.
Okay. Yeah, it looks like we pretty much got through half of it at least, almost about 111 or 12. I think we got through.
How many questions total is there,
It's
Captain?
a 200 question test. It's a lot.
Okay.
The 200 question test. Now the rest of the chapters pretty much have a lot of questions in them. So the first couple, up to like chapter 18, 19, there's like 1 or 2 or 3 questions in each one. But, again, don't rely on my reviews and just make sure that you're still responsible for a lot of the other questions that you've already had on your test before. I'm kind of skipping over some of those. So, because it's, you guys should already know that. So tomorrow, I'll send you, what's a good time for everybody?
I'll be available all day tomorrow, so.
What's a good time for you, really?
Probably after lunchtime. How about 1 o'clock?
That work?
I can do
Mel,
one.
you available?
Yeah, I could
Okay.
I could be there at 1.
Yeah, it looks like Christy's not on. Christy, you're not on anymore?
No, she got off a little while ago.
Okay, so I'll send her the link and then she can blast it out to you guys. And so I'll see you guys back at 1